Thank you so much, Irena, for the invitation and everything, organizing this event. And it's also, I think I feel very happy and humbled a bit to be here with you, because it's also an opportunity for me to present not only my research on Greece and how this kind of research started, but also a few other themes that I've been exploring and I've put together for the book. And it's among the rare times that I'm doing like a full presentation, so I'm very happy that I'm doing this with you today here. So yes, in a sense, this work started basically from my lived experience, in a sense, part of it. I was explaining earlier to Irena that part of this research I first started as a bit of through political organizing back in the day in Greece, and some volunteering I did between 2010 and 2015 in Athens. And I got mainly involved with the health solidarity kind of initiatives. Part of it was due to the local, let's say, solidarity center in the area that I live in Athens. And part of it was also due to my mother's engagement. She's a nurse, so she was collecting a lot of medicines that were unused in the hospital, and we had the first solidarity pharmacy in our neighborhood. And at that time, I also got involved volunteering. So I come a bit from the inside, and then this turned into, let's say, a few reflections and took a different direction later for my PhD. To give a bit of context, the first chapter, I will follow a bit the structure of the book for this presentation. And I will go in more depth, of course, for chapter 2, which is the chapter focused on Greece and in Athens. And we will see there a few points, not only from the lens of the solidarity movement, but also how the state at some point got involved with these spaces and the interactions there. And then I traced a few similar manifestations, but with different similar tools and practices, but different spatial expressions in the city, in a few other contexts and cities. For me, the most important starting point is the introduction chapter, which deals with the materiality, what I call the materiality of abandonment, solidarity, and care. It has as a timing and starting point, because I wanted to position it in a time frame. The movement of the squares. Many of you maybe have come across the Occupy movement, but basically it was citizens following the austerity and the financial crash in 2008, occupying public spaces across cities. We had the Occupy Wall Street, the Zuccotti Park, we had Puerta del Sol, the Indignados movement in Spain, Syntagma Square as well, and basically it expanded through cities and continents. So we will look a few to understand this materiality and the basically qualities and the spatial qualities of what happened in these squares. I wanted to highlight that this wasn't only about protest, but about collective organizing, and basically it had also a design and material dimension, and the infrastructures that were created there, I looked them as the precondition and test bed of more permanent interventions in the cities. This is the Indignados movement in Puerta del Sol in Madrid, which is one of the contexts of my research. It was one of the most extensive, let's say, infrastructural, let's say, manifestations. in my work, infrastructure comes as a notion to work together with architecture, which I look as more as the materiality or the spatial condition, and infrastructure I look as the network or system of welfare in the broader sense. So here you can see a diagrammatic map of the occupation in Puerta del Sol, and you can see the complexity and actually the diversity of the spaces that were kind of manifested there, from coordination and information and media, let's say, coordination for outreach to make the movement known, to more cultural art and library, let's say, spaces, sanitation, food station, childcare for the participants. And what I'm focusing mainly is also, as you will see later, is the healthcare and all the notions and holistic, let's say, manifestations around it. So from mental health to more medical and clinical conditions. And looking in more depth also St. Paul's occupation in London, we see again similar, but maybe the terms varied, let's say spaces. So from legal advice, which was very important to protect people living actually in the tents, to working groups for coordination, maintenance. Again, the media, let's say, infrastructure was very important, but also first aid, welfare were part of that coordinated effort, because you may think, why is that needed? It's from conflict that may happen during the protest, but also it's the conditions where you live and sleep in the weather or the tents. Like many times you are in need of medical, let's say, assistance or treatment. And then Zuccotti Park was one of the most studied and elaborated. Again, it had the first aid and medicine station, and the organizational actually and live stream kind of action of the square was kind of evident, and was the one that helped spread the movement. But it had also the survival, what I call the survival infrastructure, which was again focused on food, clothing, sanitation, and for everyone living in the squares. And Syntagma Square is basically the one I was part of. Syntagma Square has also for me a symbolic meaning, but also for the space itself, because it's just opposite the Greek Parliament. So it was in live, let's say, dialogue with the Troika, a memorandum, austerity measures happening in the Parliament, and people organizing outside for a different, let's say, type of life and democracy. So meeting in assemblies, horizontal democracy, let's say, models were taking place, which basically is voting for decision making and to run this kind of small stations of spaces in the square. And looking at all of them together, you can see that the duration was maybe short, but people worked with what they had, and through a lot of donated, let's say, materials, furniture, cafes were providing internet. So it was also a very collaborative and collective effort on the other side. And these two kind of categories of infrastructure you can see running across all the squares, and which means that the model and materiality was kind of shared in a sense. So we have the survival kind of part, and then is the organizational, what I call the organizational part, which is for maintenance, for defending, let's say, legal rights or community culture and social life. And the survival is the one that always has to be there, which covers the basic needs of people, and also it's about health and well-being. The materiality of this is very mundane, and I was looking into terms to define this, and I came across Ruth Wilson Gilmore, who said basically it's everyone providing what they have at the same time that makes this kind of collective making. And it's also it's this tent kind of architecture we can see through various is a symbol of temporality as well. But what happened in terms of impact and what followed from that is that gave me the grounds to basically continue my research. So that was just for me an important phase to trace the more permanent interventions in spaces and in cities, and to see how this kind of manifested. So we go to the second part, which is the health solidarity in Athens and what I call reconfiguring existing infrastructure. So just to give you a bit of background about Greece at that period in time, we have so we saw what happened between 2010 to 2000, basically 13-14, which was this anti-austerity movement, and this led also to the election of the left-wing party of Syriza, becoming a government at the time, which led to a series of events. But one part of the election was of the party was its movement ally kind of support. Greece at that time also was again incorporating and implementing memorandum laws, which means policies and austerity policies. It went through severe cuts into funds for education, healthcare, and you name it, basically. But the most radical and severe impact was in healthcare, where 40% almost of the population at the time got excluded from. We have a national healthcare system. So basically it was directly tied to employment and to a specific, let's say, income level. So pharmaceutical contribution by the state stopped, access to hospitals and public healthcare also stopped. At the same time, we have the what Western governments called the refugee kind of crisis and the long summer of migration for Greece, which was in 2015 again. So we are at the same time we have the election of a radical left party, the long summer of migration, and very, very aggressive territorial contestation as we have the rise of the far-right party at that time of Golden Dawn, who also was claiming to provide support and mutual aid in the streets of Athens, but they were only for Greeks. So everyone else was excluded. So it was this very volatile and but also at the same time collective kind of contestation of who the city belongs to and who participates in the making of the city. And again, many also artists from European cities visit Athens and try to document what is going on. So we have the arrival of many volunteers who participate in the Greek movement, but also artists who kind of document, and researchers, reporters, document what is going on. And vis-a-vis, let's say, in the city, because of the crisis, we had a lot of building stock that was gradually becoming empty but also left deteriorated. A few cases were like people who couldn't afford to pay to the taxpayer's office the tax of more than one property, hospitals and public administration buildings left derelict. So we had an empty building stock started that started to become available in a sense. I don't know if you have an image for Athens, but it's a very dense city, and there's very few green spaces or squares, and it's very kind of replicated model is this model of the Greek apartment building called polykatkia, which basically is the main dominated model for a building. So in between these spaces though and this density, this kind of initiatives of solidarity started to emerge. And what I call the timeline of crisis and solidarity movements that runs in parallel is basically the formation of these three periods in time that I went through, which is basically 2008 to 2011, the anti-austerity protest, the Occupy movement, and then we moved to the second phase, which is 2012 to 2015, more or less, where we see the increase of solidarity initiatives from the squares, moving like the same assemblies, the same people moving and assembling into their own neighborhoods and trying to take what they learned in the squares and the infrastructure of the squares into the infrastructure, into buildings basically, and thinking about how we can maintain this momentum, how we can provide. And then we will see later what I call the institutionalization phase, which is after the Syriza election and up to 2019 and almost 20, where again we have on the one side Syriza and the let's say memorandums, again the third memorandum I think at that time, but also a few legislations implemented that were kind of supporting a few provisions for the movement. And these provisions were mainly regarding space concessions and things like that. I thought to include only one quote, which is basically this text by Elisavet Hasa, who says that basically state abandonment occurs in spaces and is referring to social projects that are outside of what we call the market or the capital or the state kind of forms of existing. So it's this logic also of care that she says in late liberalism, and she means also neoliberalism and etc., which doesn't allow to preserve life if it sits outside of this market capital kind of logic. And I couldn't agree more. And here in this presentation, collective care then means the opposite to that, which is everything that's provisional and infrastructure that challenge and reverse these dominant systems of exclusion and abandonment, and in doing so builds counter systems. So every form of solidarity architecture that we will see, a clinic, a food bank, a cooperative center, a community-run garden, constitutes a piece of this larger network, which is a refusal basically of a world where human worth is measured by productivity and care is treated basically as scarce. So in Athens, basically this initiative spread. So they weren't only focused on the city center, located in the city center, but they were across regions and areas. The health solidarity clinics and pharmacies are for me the core, let's say, model that I explore, the main solidarity architecture. David Graeber argued that austerity kills, and it was basically what happened, and the numbers at that time were basically very revealing. This is a banner of by the Metropolitan Community Clinic of Elliniko, which is a solidarity clinic in Athens, asking for a government reform. So how a solidarity clinic emerged? The first one was in Thessaloniki, northern Athens, where basically doctors in public hospitals, they weren't allowed to provide healthcare to migrants or immigrants or people without national insurance. So they formed the first solidarity clinic in the interior of a ground floor apartment, and it was basically many of them came from the movement of the squares, but quite a lot of them were also volunteering in the moment. We had at the time the healthcare doctors' unions as well protesting for the cuts in healthcare and the catastrophic effects of the austerity policies. So essentially these clinics triggered the process of politicization, of marginalization, of what poverty meant, of exclusion in the very public sphere in the media. After that we have the first definition by Solidarity for All, which was the solidarity structure, which says that health solidarity is the willingness of people, activists, unemployed medical staff to build structures of solidarity to cope with the devastating and dangerous consequences of austerity and the liquidation of the public welfare system. So how did that manifest in space? We'll see now. Basically, they first started to occupy existing flats that remained empty, that were either granted to them for short term by maybe a member of the collective, or they were just renting and covering the bills through donations. When it was granted in exchange, let's say, to the landlord, they were paying the bills, they were maintaining the space, but they were also transforming its interior, and many times using the exact same furniture and, as you will see later, many donated equipment. So the charter in 2013, they defined also through a charter what they are, and basically they are run through voluntary contributions of active members, which is volunteer doctors and pharmacists, and their services, which is medical, pharmaceutical and mental health, are always free of charge, and they never ask basically for proof of, poverty or inaccessibility, so they leave it up to the care seeker to also become a member of the clinic and participate in the assembly and register as well in their lists. Here I will go through a few spaces of the clinic. This is the Metropolitan Community Clinic of Ellinikon in southern Athens. And you will see a typology of spaces. So first is the administration area and the secretary and waiting room, where the registration of care seekers happen. They have the assembly space, which is basically an ad hoc space where volunteer doctors, but also participants meet. Even the care seekers are also part of it. And it's also for the entire organizational scheme of the clinic. Then they have quite sophisticated and developed medical spaces, because Solidarity Clinic has very specific spatial and technical requirements. So it provides almost every form of primary care examination, and the larger ones many times have even rooms for minor surgeries. And the space is designed based on the in situ requests at the time, but also defined a lot from what medical equipment they get donated to. So that also defines, let's say, the specialty, but also the space, how many rooms they have. But many times the medical space also changes. And about the Solidarity Pharmacy, there's also a specific routine. So they collect a lot of medicine from donations. medicine from donations. Then they have the inspection space, the registration kind of. The inspection is to check what they are, but also to check expiry, let's say if they have expired, etc. Registration station is to log into through their own protocols, and then they store them in storage spaces. And they get some very also rare and expensive medicine to cover also the needs of specific care seekers. Also, pharmacies had to turn into storage spaces at some point because of national regulations that didn't allow solidarity pharmacies to operate anymore if they weren't based on a ground floor, let's say, building and to comply with the building regulations. And they collect medicines from everywhere. They have collection boxes. They get a lot of donated also medicine from volunteers outside of Greece and solidarity organizations. They have quite a few sophisticated protocols. These are letters that they send thank you and where the donation was used. And these are a few diagrams that I made to systematize the spaces and to see how the clinic and the pharmacy kind of work together, and what are the spaces of, from admin to consultation, and then its maintenance, medicine assessment, and then the spatial configuration varies a lot. And the pharmacy usually sits at the heart of this, and it's also the space that's mainly maintained and still exists because the access to healthcare has now been restored. So the clinical side is kind of getting more, let's say, almost extinct in a sense. Besides the mental health care and psychologist part. And I think the dentists as well. And another very important part is the archive for me. So I discovered, in a sense, the role of the archive of the KIFA, which means the Solidarity Clinic and Pharmacy. It has a digital aspect, which is all the documents that help from, let's say, legislations to registering patients, to work shifts, to other helpful material. But it has also a physical archive, which basically consists of the visitation book, of medical folders, of the donation book, of medicine distribution book, of the medicines that got collected, and there's a huge kind of network that they get distributed to. Then we have, they created their own versions of receipts and certificates for prescriptions, etc., with the logo and everything. So on the other side, through my archival research, I discovered also doctors from hospitals issuing similar prescriptions targeted to care seekers, to get their prescriptions filled in a solidarity pharmacy because they knew that they are so widely used and maybe the person that visited them, the patient, could not afford. So there's quite a few examples where they specifically say that please fill this prescription in a solidarity pharmacy. And the archive of KIFA is complex, but it also, it's not only about the clinic and the pharmacy and the protocols and how they work through the archive, but it's also about space making, and it's this routine of collecting furniture or getting granted a space and then reconfiguring it. And the archive has been used in all of the what I call solidarity movements of that time. And it's still kind of being composed, and it has a specific, in a sense, meaning, because the archive is a site of confliction, and what gets included and excluded in the official, let's say, formal narrative plays a role. So how this kind of counter archives of the solidarity movements also got a place and also meaning in the making of the spaces, for me was important, and it was more important for the reproduction of these solidarity architectures. I will go very fast here, but I wanted to show you what I mean about reproducing solidarity architectures. So the solidarity movements had healthcare, housing, education, food, cultural, the legal aspect as well, but they were kind of intertwined in a sense. So the healthcare, because it was one of the most essential survival kind of parts, was linked with all of them, because food is kind of medicine. Housing initiatives also needed healthcare. And in one of the visits, in one of the refugee squads accommodations in Athens, which was kind of on a former government building, with 5 floors and quite a sophisticated also conversion of spaces. So the former, let's say, office rooms were turned into sleeping areas, and the former meeting room into a solidarity clinic, the medical examination and pharmaceutical module. So basically, the clinic started putting parts of them into other structures, and then doctors were visiting these structures to kind of provide healthcare. So they were also organized across the movement and across the city. And then again, the tent kind of prototype was supporting quite a few refugee camps that again volunteers visited to provide healthcare. So the state institutionalization allowed, in a sense, for a few protocols and space to be implemented from the state side, especially from the Syriza government at the time, which created this pilot project of Athens. It never fully materialized, but what it was essentially was that through the social solidarity economy law in 2016, they found a way that they could concess officially state property to organizations or groups that helped to combat the humanitarian and environmental crisis in Greece. So they left it, I argue, intentionally a bit vague in order to accommodate not only NGOs or other, let's say, social groups, but also solidarity movements. So they listed 73 buildings in the center of Athens, and they were quite of former residencies, heritage, cultural buildings, empty plots. You will see here also the typologies. Maybe one property was on the 3rd floor of an existing residential building. One could be, as we saw in the former refugee squad, like an entire, like say, former office building. The heritage ones were usually donated and granted on a mesoterm or longer term basis by municipalities, and they had quite a few in their possession. So from happening where they could kind of where they could find, now a more organized, or let's say formalized way of interaction with the state happened through space. I created a diagram of how I understood the state was kind of grouping the buildings and the spaces in which solidarity organization they imagined could let's say, occupy these spaces. But this is just the activities, and the list is not exhaustive. And they were also the solidarity organizations had to take charge into mapping the activities, but the spaces themselves, doing a survey, finding a structural, let's say, study, or and the state also provided through the National Mapping Agency a series of drawings and maps, and this is how with the initiative, the Solidarity Pharmacy, I was a member of. We started also reconfiguring a small flat into and trying to see how we can convert it into clinic in a sense. It was also in terms of it was also challenging, and for me I started also reflecting a bit on what that meant, because it was the same government that was in a sense implementing all of this austerity kind of policies, and then on the other hand you had this initiative from the state to concess, to register, and as an in exchange you had to register your solidarity activity. The Ministry of Solidarity and Employment also was developed. So there were all these institutions in a sense emerging in parallel with the solidarity movement, and it created also a lot of internal debates for the movement itself and the initiatives themselves, and many of them kind of had to redirect or go through this internal conflict kind of debate period through their assemblies. So it wasn't, let's say, this. Also, we are speaking about a government that also, to stay in power and to form the government, collaborated with the right also wing party. So again, institutionalization wasn't a smooth, let's say, process for Greece. So I'm using the term reappropriation, and not only because of its genealogy, the political economy and all of this kind of side, but it's also to show a bit the material aspect of it in this case, which again, for me, it's always how these structures, architectures resist the dominant logics of urban appropriation and activate material agencies necessary to unsettle existing systems of social reproduction. And through these spaces, for me, although they are mundane, some of them very ordinary, as you saw, the materiality from the squares going into these buildings, it's not by design or sophisticated, but has a very specific material also expression. For me, it shows the material and the importance of space and the significance of space for solidarity movements, and how they are not different, but how they distinguish themselves from other movements in history. So now I will go a bit quickly just to show you a few other contexts, and where architecture is a bit more visible, you will see more of our tools and drawings. So I explored first Spain under new municipalism. I will not lie, I tried to trace the healthcare first movement also in Spain, and health solidarity, and it was existing. So it existed and manifested there as well. But in Spain, the exclusion from the national healthcare system wasn't that radical. So the only, and usually the scapegoat in these situations, it was the refugees who got denied of their healthcare provisions. So the way that it worked in Spain was in this kind of healthcare support network, where they were kind of accompanying people to this hospital or finding a legal route for them, or elderly. So it was also because of how Spain works, other parts were more excluded, and other regions were kind of still allowing access to primary healthcare. So it didn't allow, let's say, for spatial, let's say, requirement. this is why I turned into the more urban kind of claims and the open source aspect of it. So in Spain also we have the expression, the movement, let's say, from the square, the move from the squares to the city, again through assemblies. And I looked at Los Madrilles, which is an atlas of neighborhood initiatives, and it started first as a need for people to map the structures from the squares, the infrastructures, how they migrated across the city. And then this became even more sophisticated kind of spaces and designed and kind of neighborhood also infrastructure. It operated as an atlas and a mapping exercise first. And you could locate, if you needed a space about a playground or a commons, let's say garden, or a cultural commons exercise. And the maps started also to kind of visualize these distinctions and themes across Madrid. One of the most well-known and let's say testaments of the Los Madrilles project is El Campo de la Cebada. Maybe you have come across this urban commons project. It's located in Madrid, just a few minutes from Puerta del Sol. It was a former sports complex that the government was promising to kind of build and give it to the community, but that wasn't happening. So at the time, an initiative from students of the ETSAM Madrid, the architecture school, as well as other collectives, kind of intervened and basically claimed the space together with the neighborhood, and they created these handmade urbanism workshops. So quite a few architects were involved in this project, and they were introducing participants to the collective building process on site. Basically, they developed a plan, they established the program, they kind of mapped the areas. Again, they had the urban garden, the educational space, the cafe, the kitchen, the assembly space with this kind of furniture that also could accommodate other cultural events like theater. So it was a multi-purpose space designed as that intentionally. And for me, I also studied a bit at that time the composition of the assembly and how it operated in El Campo, because it had a very specific and intentional way they wanted to create these structures, not only for aesthetic reasons like the palette and the wheels, and that symbolizes the, let's say, architecture solidarity, but what it meant also as the meaning behind it, like sitting on a circular where the gaze goes. And I put it in a dialogue with this kind of diagramming by XML architecture, which identified the four types, I think, of assembling and parliaments. And the fifth type is this by El Campo, which is a circle and non-tiered, in a sense, hierarchy and the gaze. So the open source element was also something very prominent, and these architectural collectives were basically uploading all of their drawings into platforms like GitHub on the internet, and they designed them as such in order to be iterative in a sense. So just by having the drawings or the sequence of assembling and disassembling these kind of small structures, they were envisioning that everyone could add iterations to it and basically evolve it or adjust the prototype to their own needs. Just a few photos of how the catalog was quite of these interventions was quite impressive. And this is how I also kind of identified with this quote, which says, because it kind of epitomizes what happened through Los Madrilles, which is basically the architect can also be this diagramming force of diagramming relationships and who has access to what. And this kind of aspect of the diagram became appealing to me at the time. Then I looked at the more, let's say, permanent and intentionally institutionalized version of the new municipalist movement, which is La Borda in Spain, in Barcelona. After the election of Ada Colau and the Fearless Cities kind of platform being formed, Barcelona and Comú released its principles and commitments to guide the way, which was all about the democratization of institutions and giving the city back to citizens. I will not expand a lot on it, but Cambatio, from a former industrial neglected area, again, for many years promised to be developed for the community, remain neglected, so citizens again intervenes, collectives on the site, architecture students, architects, and they did proper master planning. Like I visited and they were having like master planning workshops, like how to do the area, like they were using terminology that was very design focused. And the government also supported the initiative through providing the plot, engaging in all the phases and negotiations for the design process, approving the cooperative dimension of the scheme, and you know, La Borda was one manifestation in Cambatio, but it was one that kind of, for me, showed the capacity of the architectural tools and architects' involvement from start to finish, but also from the state's, let's say, side as well. So it was a commitment on both sides. Cambatio is, it doesn't have only La Borda. It has so many other initiatives that take place, and from cultural, educational, etc. And then we have maintaining infrastructure, and to work with notions of maintenance and repair, I looked at Portland Works in Sheffield, and again, it's a former factory industrial site that the government at the time wanted to change its use and make it into a luxurious kind of housing, and displace basically all the makers and on the site. Again, people intervened to save Portland Works, and we had proper architectural, like studio polpo and architectural practice of architects involved in teaching, researching, but also students surveyed the space, said what needs to be maintained, how it applied for a new planning application together with the makers on the site. And basically you can see architectures, again, impact from start to finish into the process of claiming the space. Moreover, they trained the volunteers and the makers to do repair works, because to be granted like the lease to stay on the site, they had to repair and do proper conservation work. So I found that also very fascinating. And I will close with the decolonizing aspect of care. I came across the Standing Rock movement, I was explaining to Irena, by tracing donations of medicines across these movements, and quite a few donations and participants involved. Donations, first of all, from European initiatives were sent to Standing Rock at the time, but again through the Occupy Wall Street. Standing Rock basically Standing Rock was defending indigenous land from preventing the construction of an oil pipeline to cross through the site. So indigenous tribes, but also indigenous allies, made the occupation, enslaved and lived there in protest. They were water protectors. But the movement itself had characteristics a lot with the Occupy kind of movement of the squares. And I traced that. Here you can see the mapping again, and I identified the medical tents, the medical infrastructure, which was very important because we had violent clashes at the time between the protesters and the and the police. Basically, it was proper military violence against them. But most importantly, these medics and healers' tents on the side were visited by the people of the surrounding areas and regions, and they created relationship with the Indian healthcare centers. And the healthcare battle in the US is maybe more evident because they don't have national healthcare. Here you can see a few images that resemble a lot of the Occupy kind of materiality. So it's again very ad hoc, donation-based materiality. And later this, I didn't include here a lot. I'm still kind of working on how to put this, how to frame all of this together. But again, the, let's say, spatial qualities of the camps were preserved and were translated into more permanent, or in this case mobile, let's say, health care initiatives that are still ongoing, that are still existing. We have the mobile, let's say, herb care, self-care cards, mobile vans that visit communities of people in need, and they provide healthcare that's more culturally sensitive. And they have spaces that they retrofit these vans or spaces or create these cards. So it's again through a participatory process that this takes place. And you know, in the US, as I said before, the contestation is a bit more violent, and the differences are, let's say, when talking about state institutionalization there, it's basically non-existent. We have more like criminalization of solidarity than institutionalization, and that's what I looked, and I'm tracing it, of course, through the decolonial aspect. But I thought it's important to just note a few things about what I've written. So what I've written, which is basically this criminalization aspect is taking all of the terminology of mutual aid and care and using it against the very, you know, people who are exercising mutual aid. So we have cases like Hurricane Katrina that mutual aid is needed and basically the state supports it, and cases that, like the Atlanta, for example, non-cop city movement that basically asks for not creating a military training zone on indigenous land, that mutual aid gets criminalized in a sense through proper legislation. And we have terms like collectivism, mutual aid, social solidarity framed in law to criminalize or imprison activists. And it's funny because they identified with anarchy, but also saying that it's very anti-state or anti-government in a way that's a bit perverse and not responding to the reality. And this is how I will end, like, who uses this language of mutual aid and how? We have like legislation like the RICO impediment, but also the chart of the solidarity clinics in Greece using the same terms from a different angle and different purpose. Thank you.